1 in 5 students experiences a mental health concern in any given year. That's 1 in 5 of us.
70% of mental health problems begin in childhood or adolescence. That's not easy to go through alone.
1.2 million children and youth are affected by mental illness, but less than 20% are treated. Only 1 in 5 are treated.
Nearly 1/4 of the First Nation youth reported psychological distress. How do we help?
Suicide is the second leading cause of death for teens. Suicide.
My name is Andréane Fleck. I am a social worker, and I'm also an implementation coach with School Mental Health Assist.
My name is Dr. Amy Chung, and I'm a psychiatrist working at the University of Toronto and at Sunnybrook Health Sciences Centre. I work with young people and their families who are struggling with mental illness.
You are uniquely positioned as a teacher in the classroom to notice when students aren't doing very well, to notice when they're in distress or when things aren't seeming quite right for them.
The first thing to remember is that it is not your job to diagnose whether a student has a mental illness or not. There are a few simple things that you can do to help yourself feel more confident. The first is to educate yourself, to learn about different mental illnesses. The second is to find the resources that are available to you in your school setting. There's nothing like having a backup to make you feel confident about what you're doing. Oftentimes when I see teenagers who are in distress, they don't feel comfortable sharing their difficulties with their parents.
One of the most important things you want to do as a teacher is open up that conversation in your classroom. One of the primary obstacles to accessing care for students, or for anyone for that matter, is the stigma attached to getting help for mental illness or for any kind of mental health problem.
I'm sure that many of you will start the school year by talking about your approach to teaching and your approach to learning and how you're always open for them to approach you if they're struggling with difficulties in their learning. You can do the same thing about mental health and mental illness. You can talk about the fact that you are a caring adult in their life and that they can approach you if they're struggling with other areas in their life, such as mental health.
The more we talk about it, the easier it is for students to open up about it and access the supports that they need, when they need it, if they need it.
There is definitely a difference between mental illness and mental distress. Mental illness, like depression, is like any other physical illness that someone can experience over their lifetime. It is like diabetes or asthma or cancer. Mental distress, on the other hand, is when someone is struggling with a difficulty in their life and is feeling unwell about it, emotionally unwell.
It's important to recognize that though students can continue to be mentally healthy, they may also be struggling with some of these mental health problems.
So common signs of mental illness can change depending on the age of the student that you're working with. In younger kids, because they're unable to verbalize what's going on, they might behave badly, quote unquote. They might have emotional outbursts. They might get into fights with their friends. They might not be able to focus or sit still. As a student gets older, and as they're able to verbalize more what is going on, they might share with you their fears, their anxieties, or their sad feelings. They will also start to struggle with more academic work, being able to complete work on time and be able to do well in classroom settings. As we hit adolescence, students will start to withdraw from their friends, and they may start to become very defiant with their teachers and with their families. Unfortunately, some of your students will have experienced abuse in their life, and this may be in the form of psychological, verbal, or physical abuse. Abuse can have a significant impact on your student, and it can impact significantly on their mental health. In fact, the majority of students who experience abuse will go on to develop depression or anxiety as teenagers. Suicide is the second leading cause of death in young people in Canada, and it is very important that you identify students who have thoughts of suicide or hopelessness and you address it right away. If you see a student that you're concerned about, remember that by the time you notice something is going on, the problems have probably been going on for much longer. Mental health can have significant long-term impact on students. Because childhood and adolescence is such an important time for young people to develop their abilities to relate to other people, to learn, and to even grow physically, having mental illness during that time can really impact on their outcome as adults. It doesn't really matter whether a student that you're concerned about is experiencing mental illness or mental distress, because your approach to them would be the same. You would want to approach that student individually, where you can speak to them in a safe environment and they can discuss things in a confidential manner.
As you develop a relationship with your students, they are bound to turn to you for extra support. They may also want to disclose things that may be more confidential. And so it's really important to let students know that you're there to support them in every way that you can, but you have a professional responsibility to report it to someone else who is in a better position to help you.
You can identify students in your classroom who are struggling, but it is not your job to diagnose their mental illness. That is the job of the professional who can back you up. And it is important as a teacher for you to identify who those professionals are in your school setting.
It's very important for you to understand what the policies and procedures are around mental health and mental health supports within your school board so that you can know where to turn to when one of your students might be in distress or maybe struggling and you're not quite sure what to do. There are several resources that you can turn to. There are some online tutorials, for instance, that are available through School Mental Health Assist, but you may also consult with your principal to find out what some of those credible resources are. You've got your school team that can help you identify and figure out what the internal school supports might be. Your mental health leader at your school board, for instance. Some schools have access to social workers or psychology staff who are extremely knowledgeable in this area as well. So make sure you take advantage of all those resources because they're there to support you.
As a community, we're all here to help our students flourish and get the help that they need. Don't ever feel like you're in this alone. There are many of us to help you.
Thank you.
Thank you.
Thanks for looking out for us.